our rider, everything we have already showcased, and that may save a life in case of a critical situation. Castroviso and the fine vascular. We will showcase how to basically do the interrupted arterial anastomosis and the need of a good this magnification minimum 3. Hold these sutures with fine mosquito forceps with rubber shots. Something all the sutures, you tie them. We always tie, lift the next suture, and we will reach from 12 basically 6 o'clock to 12 o'clock. So when we are another trick or trade will be, so when we are taking the sutures, we are coming from farther into your side, placing the corner stage, you go little bit posterior. So know all, and but master one, practice one, and keep practicing one.